Thank you, Mayor, and thank you, Mr. Supervisor, and Andrea, thank you, and to the council members that are here, our health director, to each and every one of you, and most importantly to our Lady of Rosary for the privilege and opportunity, not just to be here to speak with each and every one of you and update you on our progress as it relates to addressing this pandemic, but also providing these life-saving vaccines to thousands and thousands of community members. It's because of the good work being done here and all throughout the state of California that the state of California now has the 6th highest administered doses of any nation in the world. The state of California has now administered over 24 million doses of vaccine. We lead this nation by some 8.1 million, more than any other state in this country. Texas has done well, but the state of California is administering doses at scale. Accordingly, we are committed to the cause that unites each and every one of us, and the cause and the spirit that was advanced in the three speakers and their comments, and that's the issue of equity. It's been stubborn and it's been hard, but it's foundational. And we are not going to take our eye off that ball and eye off our responsibility to do more and to do better to advance that cause, as we announced today that every Californian is now eligible, regardless of their age, 16 and over, to receive and have access to vaccines. Today marks 3 milestones of sorts. Today, not one county in California is in the purple tier. Every single county in the state of California is out of the most restrictive tier. Number 2, roughly 50%, half of the population in the state of California that is eligible to receive a vaccine has done so. 49% to be exact. By midnight tonight, likely we will pass that threshold. Half the population, 50% of Californians that are eligible to receive a vaccine have received a vaccine. And notably, as the mayor was reminding me, she has a day job in addition to being mayor, and that's working on tax policy. April 15th, officially in 2021, in the state of California, is not tax day, it's Vax Day, meaning every eligible Californian, again, can now access the administration of a dose of vaccine. And while it is true that we had a temporary pause, a temporary setback with one of the approved vaccines, J&J represents just 4% of our weekly dose administration. So we more than able to make up for that with Moderna, which is being supplied here at this site, and the Pfizer vaccines, which we anticipate will increase in terms of availability and manufactured supply. The only constraint in the state of California in terms of administering more doses is manufactured supply. We administered over 2.7 million doses of vaccine last week, 517,000 doses in the last 24 hours. 2.7 million in the last week. We have designed a system where we're capable of more than doubling that to 6 million vaccines a week. Again, the only limitation, the only constraint is manufactured supply. We are looking forward to getting more vaccines and more arms for one fundamental reason: it saves lives. These vaccines are safe. These vaccines are effective. These vaccines will get our kids safely back in person in school. These vaccines will quickly and safely get our economy moving again in a sustainable way, getting our small businesses back up on their feet. We're already seeing signs of a recovery in this state. We talk about California roaring back. Well, let me give you a proof point about that. In February, the national jobs numbers came out. 37% of all the jobs were created in the United States of America. 37% came from the state of California. And that doesn't surprise any of us out here. The industry that's been hit most hard by this pandemic, the industry that's been most impacted by this pandemic, broadly defined as hospitality and leisure. That's the industry that's going to come roaring back. 102,000 of our 141,000 jobs in February were jobs in the hospitality and leisure industry. That was February. Wait till the March numbers come out. This state is ready to come back, come roaring back. But again, foundationally, the architecture of that is getting more shots into people's arms. And 50% of eligible Californians is good, but it's not good enough. And we are not prepared as a state, as a nation, in the world more broadly, that we're trying to build around, to run the 90-yard dash. We have work to do, and that work is manifested at the local level. There's no substitutes for sites like this. I know there's a lot of focus and a lot of energy on these mass vaccination sites, but the backbone of our vaccine delivery system is communities like this, clinics like this, partnering with churches just like this with an equitable mindset, an equitable framework, doing that hard work every single day, individual by individual, 100, 200, 300, 400, 500 doses in people's arms, at mobile sites, at fixed sites, meeting people, as was stated, and I love these street teams, meeting people quite literally where they are. Yes, we're blessed to have those two larger sites, one here in Alameda County, one down that is supported by a lot of federal employees down in Southern California. But that's additive. The critical work continues to be done with clinics and with partnerships like this. The state has now created a framework of support where there are 337 community-based organizations we have partnered with. Some $52.7 million has been invested to do exactly what you were saying, to focus on trusted messengers, in-language outreach, neighborhood by neighborhood. The Promotoris program, we talked to a number of their leaders that are here, quite literally knocking on people's doors, block by block, door by door, and reaching out to people that may be hesitant, may have concerns, and may offer new considerations based upon the feedback and information they're receiving. Again, we are continuing to focus on those outreach efforts. Because we're opening up this vaccines to everybody doesn't mean we're letting off or stepping back from that commitment. 40% of these doses continue to flow towards this equity metric. We talk about that 24 million vaccines. The number that I'm most proud of, though not yet satisfied with, is the 4.84 million that have gone into our most impacted communities in this state. Those 4.84 million vaccines that have gone into what we refer to as our Healthy Places Index Quartile 1. And if I've lost you, or if I haven't lost you, you weren't paying attention. The HPIQ-1 is really an important metric of our success in terms of meeting these equity goals. But as I state, we still have a lot of work to do. And so we are here in particular highlighting those efforts, highlighting one of those zip codes and those census tracts in our state, highlighting the good work and partnership of these trusted messengers you see behind me, and celebrating this milestone here in the state of California in terms of availing these vaccines to all Californians 16 and over. If you haven't taken the time to get a reservation, go to My Turn or call your local health officers, go on websites, find out which vaccine distribution site, could be a pharmacy, could be a clinic, could be a mass vaccination site. Find out what's most proximate to you and get a reservation. More and more vaccines are coming in. These vaccines remain safe. These vaccines remain remarkably effective. Final words. It's just incredible to consider where we were just a few months ago. Today, California has the lowest positivity rate in America, which is a remarkable statement of a state as large as the state of California. We have the lowest positivity rate in America. 24 million doses of vaccines have been administered. Roughly 2,300 people are hospitalized, proving still how deadly this disease is. But consider in January, we had close to 23,000 people hospitalized. 22,300 was the peak number. Today, roughly 2,300. We are making progress. We're going to defeat this disease. We're going to end this pandemic. There's a bright light at the end of the tunnel, but we still have more work to do. Final words. Please be mindful that this disease is not taking the month off or the summer off. This disease has not gone away. The only reason we are enjoying the lowest positivity rate in America is because of all your hard work. It's because of not only those of you that have availed yourself to life-saving vaccines and have shown yourself as an example and a leader in your own right by doing so, but it's also all the other important work that is done every single day with non-pharmaceutical interventions, meaning wearing face coverings. Let's not let down our guard. Let's not take these masks off. We still have work to do. The biggest mistake in this country that's being perpetuated are people that are just giving up and not requiring these face coverings and just assuming that mission somehow is accomplished. It's not. This disease will come roaring back. Ask the governor of Michigan. Ask folks around the rest of the world, the rest of the globe. Large economies shutting back down in places like Italy, France, challenges in Germany. These variants. We have a UK variant. 20% of all the March cases that we have currently sequenced, 20% of them are the UK variant. 53% are the West Coast variant. These mutations are deadly. These mutations are real. These vaccines are a race against these variants, a race against these mutations. Let's keep our guard up. Let's take this moment seriously. This is an exciting and proud day because now we have lifted that burden and that anxiety around age and conditions and availed every Californian 16 and over the opportunity to get these vaccines. But now the hard work is inside of each and every one of you to manifest that ideal, to get us to June 15th, to get us past this pandemic and back to a sense of normalcy and allowing ourselves to, with all of the vibrancy that is inside all of us, to come back, roaring back as Californians as we will. So thank you all very much for all of your incredible work, all of you. And thank you to 40 million Californians strong for the remarkable job you've done for this very, very challenging year. Mindful that June 15th is just a few months away, but we've got a lot of work still to do. With that,